Good morning, everyone. Welcome back from the break. And before I dive in, thank you so much to the folks at the Fat Disorders Resource Society for allowing me to come up and speak to you for a few minutes and for pulling together such a fantastic agenda over the last few days and today and tomorrow. I really like the new dual track format. It's packing more into the 3+ days, and it's been really fantastic so far. I'm Jonathan Card. I'm the CEO of the Lipedema Foundation, and I'm going to spend a few minutes talking to you about some of the resources that we have available to support the journey to finding effective care, and a couple of new things that we have in the works and are launching at the conference as well. No disclosures. So first, just a few words about the Lipedema Foundation. So the bulk of what we do is fund research. So we provided almost $13 million in research funding globally in the roughly 9.5 years that we've been in existence. And most of that research goes to support better understanding the biology and improving diagnosis. Those things are really important because in order to find the next generation of therapies that might help folks with lipedema, we really need to understand what's going on with the disease at the level of the biology, at the level of the cells and tissues in the body. We also do things to support infrastructure for the research component of the field. So by infrastructure, I mean things like the Lipedema Foundation Biobank, which we launched just a couple of days ago. Before going on, a tremendous thanks to those in the audience who have participated in the biobank already. Yeah, I think that deserves a round of applause. This is something that has been sort of a dream of ours and of many in the field for years now. And Thursday morning, we consented and enrolled our absolute first participants. And the first samples arrived at our biobank facility in Piscataway, New Jersey yesterday morning. So the biobank is real. It truly exists in the world. And many of the folks in this room can say that they were the first people to participate in this brand new effort. And this is something that's going to, we hope, pay dividends for years to come. We don't know yet all of the research that this is going to support, but we know for sure that this is the foundation for higher quality research going forward. We also do work to build awareness, and I'll talk a little bit more about some of the things that we're doing around that in the course of this presentation. This is our team. Hopefully at this point in the conference, you've gotten a chance to meet most of these tremendous folks that I have the privilege of working with. You may not have seen much of some of them because they've really been hard at work in the biobank recruiting event, but I hope if you hadn't had a chance to meet these people, you'll come by our booth, you'll seek us out in the hallways. So first, the good news. Awareness, as I think many folks in this room have noticed, is really increasing pretty rapidly. So here I'm talking about general awareness, and this chart shows monthly search volume on Google just for the term lipedema. And this shows, this is monthly, so you see just a huge growth from October of 2023 to October of last year, just a few months ago. And the annualized number of visitors going to Google and searching for just the term lipedema was over 1 million in 2024, which is tremendous growth. This doesn't account for all of the people who might be searching for symptoms that they may have without not yet knowing the term lipedema, who would end up on lipedema content and learn more about it that way. So awareness really growing. I think this is really great news. And yet, as I don't have to tell many folks in this room, the journey to getting a diagnosis and effective care is way too long. This is data from a couple of years ago based on our registry survey, which many in this room have also participated in, just showing a delay of decades between the onset of symptoms for most folks and then looking for care, finding and getting a diagnosis, and then getting access to treatment. And I think we can expect that as awareness increases generally, clinician awareness is also increasing. But the experiences that I know everyone in this room has had really show that clinical awareness is lagging far behind the general awareness picture. And so we've invested in creating a good number of resources to help us do that. We spend a lot of time pounding the pavement, talking to HCPs, going to clinical conferences, talking about lipedema, educating people. And one of the first things that we knew that we needed when we started doing much more of that was a really quick takeaway 2-page guide that just says, what is lipedema from the perspective of a clinician? So what knowledge do you need to diagnose it? How should you think about treating or referring out for treatment for it? How do you code it from an insurance and reimbursement perspective, from an electronic health records perspective? So this guide, we've gotten great feedback on this. It's just the first version, and so it's, I think as our understanding of the condition changes and maybe new standards of care are released in future years, you can envision that we might go back and update this, but we're already hearing great things. And some of the things that we're hearing is that for sure, for clinicians who are new to this, they love having this easy takeaway 2-page, what do I do when someone comes into my office and asks me about lipedema or has some of its symptoms? But we're also hearing, though we didn't intend it this way, that it's a tremendous patient advocacy tool, that folks are sharing it with their clinicians, and as is probably familiar for many of you, you all are educating your clinicians on this, and some are more receptive to that than others. But we've also heard that other than taking it to the visits, things like uploading it to the digital health portals for your providers can also be really helpful. So we didn't know that it would be helpful in that way. It's amazing to hear that people are using it that way. This is available at lipedema.org/clinicians. We'll send you copies of this in paper form as well. We've had a treatments page for a long time, and for a long time we were very much standing on the shoulders of giants and using the FDRS's fantastic treatment butterfly diagram as sort of, okay, I've gotten a diagnosis or I suspect I have lipedema, where should I start? And so in early last year, we reached out to the community to update that graphic and add to it because the treatment landscape has changed over the past few years. And the simple question was, what treatments have you been using that you're seeing some effectiveness with? And the first thing that we learned from that is it's extremely diverse, the answer to that question, right? What works for some people seems like it's not working for other people and vice versa, especially when it comes to conservative therapy. But we created this diagram, which you most certainly cannot read all the details of since it's so small. It groups the vast array of treatments that folks are trying by intended outcome. And it incorporates extensive input from the patient and the clinical community. So please go check this out online. This is not medical advice. We are not medical providers. This is reporting back what the community is telling us about therapies. So this is a lot of detail, but for those for whom it is not enough detail, we also created the what we call the treatment tables. And so here you can dive even deeper and look at things like a roughly and relative comparison of cost of these effective therapies. You can go deeper into this as well. So that's all new. Check it out. The other question that we get sometimes multiple times a day is, can you help me find a provider in our area? And at the FDRS conference last year, we launched our first ever provider directory, and we intentionally focused on therapists. The therapists in our communities are often the linchpin of lipedema care, and it's not within the scope of practice for most therapists to provide a formal diagnosis. But often, as you know, they're the first people to recognize lipedema and its symptoms in people with lipedema. And we hear time and again that therapists are in the position of advocating back to a referring physician and educating them on lipedema. And so we started with therapists to pilot this. And our goal for the end of 2024 was 75 therapists in the provider directory. And we had about 300 by the time we hit December of last year. So much more than we hoped. Thank you very much. My assumption is that any therapists, and by therapists we mean PTs, OTs, LMTs, CLTs, all the Ts, my assumption is that all of those folks are already in here, but please consider joining it if you are not there. And so the next step for us, which we're launching here at FDRS, is phase 2, which is providers who diagnose and provide conservative treatment. And this is not a public-facing directory yet. We want to make sure that there are enough clinicians in the directory before we show it to the public to truly be helpful for people. And we also want to work out some of the particular challenges that come with recruiting physicians who provide a diagnosis into the directory. So the public-facing directory will be coming soon. For now, the request is, if you're a provider who diagnoses, please consider joining the directory. You can access the intake form for that with this QR code. You can also find everything about both of these segments of the directory at lipedema.org/providers. This is a big push. If you are a provider, or if you're a person with lipedema, or anyone else who knows providers that we should reach out to and to invite to join the directory, please let us know. I'll give you a way to do that at the end of the presentation. I don't have time to talk about all of the resources that we have that can support the journey to effective care, so I'll just name check a couple of them. You can check out more at these links on our website. One of these is the brochure. I think probably a lot of folks encounter lipedema for the first time through this brochure. We've given out hundreds of thousands of these at this point. We'll send you as many as you want for free to help educate others in your networks, to have in your front offices if you're a clinician. We have a patient self-advocacy guide. So, I mean, wouldn't it be great, and of course, wouldn't it be the right and just thing for people to be able to show up in a clinic and have their providers know what lipedema is and know what to do when they encounter someone with lipedema? Unfortunately, that's just not the world that we're living in today. It's the reality. And so the patient self-advocacy includes a whole host of strategies, ideas, and tips that we've collected from members in the community about how to advocate for yourselves. It's not foolproof, but our hope is that this can set you up for a better chance at access to care. And other resources more on the research side of things. I mentioned the registry report that we released in 2022 in the early part of the presentation. In addition to the biobank, we also have our patient registry. If you haven't joined that yet, please check it out. It's an opportunity to provide some data about your experience with lipedema and also to sign up to be contacted for participation in future study opportunities. We have a trial finder. This is a way that you can find out about currently recruiting clinical trials in your area. And we also have a research library which has a whole host of resources about lipedema, adjacent conditions, and pretty much anything that could be relevant. So I mentioned that we've been pounding the pavement. That really means showing up to as many clinical conferences as we humanly can with a relatively small team. And so I want to tell a quick tale of 2 meetings of the 40 or something that we attended in the past year, either in person or virtually or through sponsoring. So in October of 2023, we participated in a session on lipedema. We curated a session on lipedema at the Obesity Week meeting in Dallas, which is sort of the biggest gathering of obesity medicine clinicians as well as researchers. It's a very research-heavy meeting. And this is kind of the first time that we'd ever done anything like this at this meeting, and we had no idea, especially since it was a pre-conference session before people were even showing up, how many people would come to this session. And it was standing room only in a room that was meant to hold about 250 people. There were over 300 people who showed up to this meeting. And so we did that, and I think that really told us that there is a tremendous hunger for information about lipedema in some clinical communities. This is certainly not a universal experience. Some specialties are further along in their journey than others. We're working on that. But this was a great piece of early feedback that this was a strategy worth pursuing. And then just about 7 months later, we attended the international version of this meeting in Sao Paulo, Brazil. This is the International Congress of Obesity 2024. And at that point, it was in a room that was a little over double the size, and we were standing room only there. There were over 700 folks in attendance at that meeting from all over the world. So quite a change just in a number of months. I think you see tremendous growth and interest in lipedema in certain pockets of the community, and it's all we can do to honestly serve the interest, the demand from those interested parties. We definitely need to start telling an even better story to get people who aren't interested knowing much more about this as well, but I think this is a sign of, although lagging progress compared to general awareness, some of the progress that's happening in clinical communities. We need some more ideas about how to do this even better, though. So I mentioned an opportunity to submit ideas of clinicians that we should reach out to participate in our provider directory. We have a quick poll. It should take no longer than 5 minutes, just soliciting ideas from folks in this audience about how we can enhance our provider education efforts. And so this includes not just a question about ideas for who we should try to get in the directory, but also one of the main ways that we need to reach clinicians at scale is through their medical societies. I mentioned, an example of that, like the International Congress on Obesity or Obesity Week. But societies and conferences where lots of clinicians and relevant clinicians attend is where we need to be. And so if you know people who are in decision-making roles at these organizations or who could be champions at these organizations to help get lipedema on the agenda, please let us know through this survey. And we also just want opportunities in general to present to clinicians. And then the final ask I will make of this audience is that everyone here has been hearing the chatter about GLP-1 and GIP medication use in the lipedema community. There's so much anecdote about people's experience with these drugs, some good, some bad. but we don't have a whole lot of structured data on which of these drugs are people using, what are the outcomes in general in terms of their quality of life, and specifically on their lipedema symptoms of taking these drugs. What are some of the bad experiences that people have had in terms of the side effect profile? And so this is a little bit longer than 5 minutes. It seems like it's taking people between 12 and 15 minutes to complete the survey. But if you'll consider helping us do this, the hope is to publish this and get the word out about this in a really structured way. Thanks so much. This is our contact information. Please don't hesitate to reach out to us and check out all the Lipedema Foundation's FDRS materials at the link on the slide. Thanks a lot.